Hi, Erin. How are you?
Doing well, thank you. Good morning.
Good morning. Thank you for joining us. We're just asking everyone while they're coming in one by one to give us one word on how they're feeling this morning. Erin, if you'd like to give us one word on how you're feeling, it's just a check-in.
Motivated.
Motivated. Good place to be. Deborah's excited. All of you who are coming in, if you could just give one word check-in. How are you feeling this morning? Calm. Wonderful place to be. We'll wait just a couple more minutes here. We have 2 minutes until the hour. And for those of you also joining us, at any time, you can put some questions in the Q&A or the chat, and we'll get to them at various points throughout the presentation. If we run out of time, which I imagine we will with the number of participants who are coming online here, we can always do some follow-up and answer any additional questions at the end. I do think with the questions that we have in queue that we will get to probably most of your questions, if not all of them. Okay, for those of you just joining, if you could put just a one-word check-in, how are you feeling this morning? Oh, good morning from Yuma, Arizona. Thank you, Luis. Laura's good. Happy it's Friday. Yep, happy Friday. Although I know many of you are working weekends too. Cozy on a snowy day. I like that one. Overwhelmed. I get it, Amy. Hopefully we can provide you with some information that will help relieve some of that overwhelmed feeling. Tired. Yes, Megan, you're in Seattle. You should be tired. Okay, why don't we go ahead and get started? It's 10 o'clock on point here, and we're going to go ahead and start with introductions. I first want to thank our distinguished panelists today for making the time for us. I know that you have to be incredibly busy. We appreciate you so much. And I want to personally thank, and from the organization, thank the CDC in general for being the leader in providing information that we need on COVID-19 throughout the entire outbreak process. You've been the federal agency that's taken the lead on giving us some sort of guidance throughout this very difficult time, especially for those who are in attendance today who directly service our students experiencing homelessness. So we're very appreciative for that. I know that we have put the CDC resources on our website throughout the pandemic. And as things have been fluid, all the additional information that the CDC has provided, you have a number of units, and we have 2 units represented here today. But I know that most recently we have relied, and our attendees and members have relied upon the great resource that the CDC has provided on eviction moratoriums and tenant forms, and how to go about ensuring that our tenants are not evicted during this time while there is a moratorium. So we're very appreciative for that as well. But today we're going to focus on a couple of things, and one is the vaccine rollout, and the other one being schools and school reopening. So I first want to introduce our 3 distinguished speakers from the CDC, Dr. Emily Mosidis, and also Dr. Erin Saber-Schatz, and Dr. Dara, Dara, I apologize on your last name, but Schluter? Okay, and first, Dr. Emily Mosidis. She is Lieutenant Commander, United States Public Health Service. She is an infectious disease epidemiologist at the Center for Disease Control and Prevention in Atlanta. She is the Senior Advisor on Homelessness and Health to the Deputy Director for Infectious Diseases and leads the COVID-19 Response Homelessness Unit. She is also a commissioned officer in the United States Public Health Service. Dr. Erin Saber-Schatz is in the CDR, U.S. Public Health Service. She's the task force lead. She's Community Interventions and Critical Populations Task Force. She's the CDC COVID-19 Emergency Response. So also welcome to you, Dr. Erin. And Dr. Darren Schlater is also with the CDC and with our schools unit specifically. If you could also tell us your title.
I'm a health scientist at CDC. I'm currently serving as a K-12 schools SME on the schools unit within the community guidance team.
Wonderful.
And I have not earned the title of doctor, but
okay. But you are a scientist.
But I am a scientist, yes.
Well, we're very appreciative for all of you taking today. So I'm going to start with Emily, we'll just keep going around here. But Emily, if you could please explain your job a bit to the attendees as it relates to them in schools, and that could also assist in us with some questions as well.
Sure, and I do want to point out that Dr. Saber-Schatz is going to have to jump off at 10:30, so we might want to first direct things her way. So just to introduce myself again, I'm leading the homelessness unit here in the CDC COVID-19 response. We do a couple things on our unit. So we write guidance related to homelessness specifically that's up on the CDC website, and I can put a link to our landing page in the chat box so you can take a look at that. And our guidance covers a variety of things. We cover testing, we have vaccination guidance related to reaching people experiencing homelessness. We have homeless shelter guidance. We have guidance related to unsheltered homelessness. So we have a really broad range of resources and also frequently asked questions. So there's a lot of resources there, which actually ends up being a bit much to sort through. So we're also available for technical assistance, and we help support shelters, state and local jurisdictions, if they're working through a problem. So we're on the phone with health departments and with homeless service providers on a regular basis to support them. We also sometimes, similarly, will do field deployments if there is a problem out in the field that requires CDC assistance. Sometimes we'll send a team out to help with that. And then one of the last things we do is we do some data analysis. So we are constantly looking at data coming in to try to understand what are the risks related to COVID-19 for people experiencing homelessness, and what can we do to help prevent those risks. And I'll turn it back to you, Tisha.
Thank you. Dr. Erin Saber-Schatz, if you could tell us a bit about your job and directly how it might be related to some of our attendees here.
Sure, absolutely. Thank you again for having us here today. I've been with CDC since 2009. My day job, as we say, is in the injury center at CDC. So I work on transportation safety. However, whenever there's a public health emergency, CDC employees apply their skills in different places. So when I was doing my PhD in epidemiology, I also did a certificate in public health preparedness and disaster response. And that's also the reason why I joined the public health service, is to be able to respond in public health emergencies such as the one we're experiencing right now. And so throughout the response, I played a couple different roles in CDC's COVID-19 response, but the one I've spent the most time doing is the task force lead for Community Interventions and Critical Populations Task Force. So we write the guidance, we provide technical assistance for communities and where people live, work, learn, and play. And so for this audience, it is our work around schools and also homeless populations that I think directly applies.
Thank you. And Dara, if you could also tell us a bit about your job and how it specifically relates to our individuals servicing our students' experience.
Sure. Like mentioned, my day job is in another topic area. I'm a health scientist in the Division of Cancer Prevention and Control, and I focus on program evaluation normally. But years ago, I did work in comprehensive school health and the school health, what used to be a division. And so I've ended up here on the response, serving in the schools unit on the community guidance team. And we focus mainly on developing and updating guidance for schools, parents, guardians, and school administrators to mainly to focus on implementing mitigation strategies within schools to reduce the risk of COVID-19 spread in schools. There are constant updates to our tools and guidance because the science is always evolving and there's always new information to add and information to kind of update based on that evidence. A lot of our tools focus on reopening and operating safely once reopen. There are also FAQs and some tools and resources for school nurses, for parents and guardians, for helping children cope with learning in the school building, at home, and everything related to instruction in this time. So that's what we focus on. Thanks.
Thank you. And we'll go ahead and do some follow-up. I'll follow up with you as well and get some of those links and then provide them afterwards for all the members, including those who weren't able to make it today and some who will be reviewing the recording. So why don't we focus on schools then for a while with Erin and Dara. And I know that most recently there has been a guidance put out by CDC on reopening of schools. And I know that President Biden, the administration, had an aspirational goal of reopening in the first 100 days. So if we could talk a little bit about the guidance and whether the recent mutations, 3 of which I believe we know of, the UK, South Africa, and Brazil, whether that has changed any of those aspirations.
Yeah, sure. This is Erin. I can start with that question. Of course, the variants are of high concern to all of us in public health, especially with some of the experiences we've been seeing in England and South Africa and Brazil. So in our K through 12 operational strategy that was just released last Friday, we do indicate that the variants are out there and that we're keeping close track on them, and that essentially, depending on what we see in the United States and how the transmission might be different with these variants, we of course would make different recommendations for schools and frankly all settings based on what happens with the variants. For the K through 12 operational strategy, I think probably many of your members are highly aware that we've been putting out guidance, resources, and tools since last summer. So as soon as schools started closing in March, we got to work on thinking through what schools would need to reopen safely in the pandemic. I don't think any of us anticipated it to go on this long. And so as Dara said, we continue to monitor the data and the literature and make updates to our guidance as we learn more about COVID-19. I'm happy to outline some of the pieces that are considered new in the K through 12 operational strategy, because I think anyone that has been using our guidance and resources and tools along the way sees that a lot of the messages and things that we recommend are actually still the same. We have come out stronger with the universal and correct use of masks in a school setting. So that's a piece that we had not come out as strongly about previously, but the more we learn about masks and how if you improve the fit and filtration of a mask, it not only protects others, but also protects the wearer, we have stronger language in the operational strategy around mask use. And then of course, physical distancing, we continue to recommend 6 feet. I know we all know that this is not possible in every classroom. So there is language in the K through 12 operational strategy to maintain distancing to the extent possible. However, as you get to areas where there's higher levels of community transmission, that increases the chances of having staff or students in the classroom with COVID-19. And so we really do make a strong recommendation around physical distancing at 6 feet. I think there are a lot of lessons learned out there from schools that have implemented the guidance. Some have used cafeterias, libraries, or even gyms to help help increase the spacing between students, but still have students in a school environment. So those are two pieces that I would say are newer. However, in addition to universal and correct masking and physical distancing, of course, we still recommend hand washing, respiratory etiquette, cleaning, and also maintaining healthy facilities, which the healthy facilities piece includes ventilation. So in the K through 12 operational strategy, there's been a lot of attention around ventilation in the news recently. And so we do talk about ventilation, and we link out to a ventilation in buildings page on CDC's website that is run by the National Institutes of Occupational Safety and Health, where the experts of ventilation where they reside. And so that ventilation in buildings page is where you can see different options to improve ventilation and also cost estimates for those different types of ventilation that can be applied. And I can pause there and see if there are questions. Otherwise, I can continue to run through what we consider to be new in the operational strategy.
I don't have any questions in queue, so if you want to go ahead.
Okay, sure. And so I think the other piece of this that is considered new is if you all were following our guidance from last September, we did put out indicators for dynamic school decision making in September of 2020. That was a five level indicator of community transmission. It also included percent positivity and then additionally secondary indicators. So for anyone that had been using our previous indicators, we built out content in the beginning of that page to crosswalk the new 4-level indicators in the operational strategy with the old 5 levels so that you can see what the differences are. In truth, there really aren't very many differences. We collapsed the lower categories, and then we changed the time frame for the cases per 100,000 population to 7 days instead of 14, because we at CDC have that information available on a 7-day time frame. So it makes it easier for people to access the information versus having to do the calculations themselves. And then with the low, moderate, substantial, and high levels of transmission, we for the first time are making specific recommendations on learning mode as well as extracurricular activities based on those levels of transmission. We also know that there are differences in transmission by age among school-age children. And so we have some slightly different recommendations for elementary school kids compared with middle and high school. So that's something that people will see. We have also prioritized in-person learning over sports and extracurricular activities. I was a student athlete, so I understand all the ins and outs and the importance of sports and extracurriculars, but we really are making recommendations that in-person learning should be prioritized over extracurricular activities in communities with high levels of transmission. I think the only, the other pieces are that we've heard from schools that some schools have considered putting a testing program, a screening testing program in place and wanted advice on what that would look like and what we would recommend if they wanted to layer on testing as another prevention strategy to help schools stay open safely. So we do have recommendations based on the level of community transmission for how to do screening testing. In addition, knowing that setting up a screening testing program in a school takes a lot of time and effort and thinking, we also talk about some of the things to consider before putting a screening program into place in a school. And then lastly, we also talk about vaccination. So vaccination is now, of course, something we recommend everyone get when it's their turn. And we talk about the ACIP recommendations that CDC supported for teachers and school staff being in phase 1B for vaccination. We know not all of the states have followed those recommendations, but we do recommend vaccination for teachers and staff as another way to make the school and the school environment safer. So I think I think that those are all the pieces that are new per se in the K through 12 operational strategy. And I will say though, also we put out a science brief on SARS-CoV-2 transmission in K through 12 schools. And the science brief, it has over 60 references in it. It really was meant to be a summary of the literature and the data and the evidence that we have right now. And that science brief was the basis for the recommendations that we're making in the K through 12 operational strategy.
Okay, and we do have one question in. The question is, are there special air filters that are needed in larger buildings?
Yeah, so the thing that I always say about ventilation is that the purpose of the ventilation prevention strategy is if you had someone in say a classroom who was positive with COVID-19, the whole purpose of ventilation is to reduce the concentration of their respiratory droplets or viral particles in the air. And so things such as opening windows and doors, which we know in some schools is not possible or goes against safety protocols. But if you're able to open windows and doors, that circulation of fresh air in with the air that's in the classroom helps to reduce the concentration of those viral particles. And so it can really be as simple as cracking windows and doors. That's also a recommendation we have on school buses, is cracking the windows just to help the air circulate and clear out any potential viral particles. On the ventilations and buildings page, which I'll put in the chat, we have laid out different levels of things that can be done to improve the ventilation in a building. So HEPA filters, for example, is something that some places have used. Running the fans of a HVAC system, even if the heating or cooling isn't on, running the fans helps circulate and filter out the air. So that's not, I'm not a ventilation expert. The people at NAEHCY and some of the people in our task force, they live and breathe that content. So I would direct you there because there are specifics on that page of different filters and options for ventilation, as well as the cost per room that the different options can cost. And then just finally on ventilation, I also want to just reiterate that it's another prevention strategy. So if you have a well-fitting, well-filtering mask, the purpose of the mask is to prevent the viral particles from ever leaving that contained space around your face. So, you know, really that's another reason why mask use is so important, is because it helps prevent those viral particles from ever even getting into the air.
Okay, and then the next question regarding the variants is whether there is any deviation in the strategy or guidance or anything currently being talked about that may specifically alter any of the guidance based on how the variants go, whether another variant pops up.
Yeah, and I think, as I mentioned, we're watching the variants very closely and collaborating with states. We're doing genomic sampling of cases of COVID-19 to find out what variants are out there, where they're circulating. But I think the important message to make, well, there are two. So one thing is of course, schools don't exist in a bubble. So anything that we can do to help reduce community transmission is going to help our schools stay safer. So we really do need everyone to do their part in the community to help schools open and get more kids back in the classroom. Most of the cases that we've seen in classrooms have come in from the community. It's not the secondary transmission that's occurring in schools in most cases. It's more imported cases from the community. For variants, the thing with the variants is by the time the genomic sequencing is done, the variant will have already been in a community. So that's another reason why we really need everyone when they're in the community, at the grocery store, you know, visiting with friends and family that don't live with them, to make sure that you're wearing a mask and that you're keeping your distance, because that's going to help not only reduce the spread of COVID-19, but also reduce the spread of variants. So it really is, we know that everyone's tired right now from the pandemic. We are, we definitely are. We all want this to be over with too, but it's not the time to let down our guard. If anything, it's the time to do more, to take a look at your own behaviors, your own practices, and see where you can do better to protect yourselves and your family and your friends, which in turn will protect the community as well as the schools.
And then this will be the final question for you, and then we'll relieve you. And if there's any follow-up, I'll be back with you directly, and I very much appreciate your time. Is there any way to mitigate, and I know that the CDC is putting out guidance on mask wearing and distancing, but are there any other strategies that schools can utilize in order to mitigate the spread out in the community that's then imported into the classroom? Whether there are like posters or resources on the CDC that maybe having parent-teacher meetings or putting information out to the parents.
Yeah, I do think that the school and the teachers or school administrators and even parents, they can help carry the message of let's all look at what we're doing. Let's work together to get our levels of community transmission down so that we can get more of our kids back in the classroom. At CDC in the last few months, we've been talking about schools should be the first to open, last to close. We really do believe, because of the benefits of in-person learning and all the support services that schools provide, that they should be prioritized over non-essential businesses and activities. And really, it's a priority to us to help get community transmission down so that we can get kids back in the classroom. I would also say that our K-12 operational strategy also talks about health equities. We know that there are many students who might have been disadvantaged before the pandemic, and we're seeing some of those divides continue even further, especially in communities that don't have access to internet, broadband, and the things that they need to do virtual learning when their school is closed. So that's just another reason that we're putting schools first in the community and really need everyone to do their part. I would also say that we released in collaboration with the Department of Education. So they put out their first handbook on opening schools safely. And so that was a great collaboration with the new administration. And I'll put the link to their handbook in the chat so that people can see that. But they also talk about some successes that they've seen in the schools and how different schools have been able to implement our guidance. And they talk about some of the funding opportunities that could be available for schools since the funding piece is more their lane than CDC's. I'll put the link to that in the chat.
Thank you. And with that, we are on for another half an hour, but we're going to go ahead and let Dr. Erin Sauber-Schatz go about and do the rest of her important work for the day. And we're very appreciative for your time. Thank you.
Thank you. Thank you so much for having me. And as Emily and Dara said, we're here to answer questions. We're here to provide support. So please let us know what you need, and we'll be happy to link you out and or provide that technical assistance. I'll find the link to that Department of Ed handbook and put it in the chat. And then thank you again so much for having us. Really appreciate it. Have a good day.
Thank you. You too. And Dara, if we could just follow up with you on some of those questions that were asked of Erin in regards to the guidance, and especially as it relates to the schools.
So I think Erin covered really well kind of what is presented in the operational strategy and how we think about the connection between community transmission and what goes on in schools. I would just echo everything she said and just reiterate that the school guidance that we have on our website, and I can provide some links as well, really does emphasize those prevention strategies, mitigation strategies, as we also call them, and enforcing them consistently within schools as much as possible. We talk a lot about the layering of prevention strategies, which would be, the combination of as many of the strategies as possible really does help to reduce COVID-19 risk in schools. And so a lot of our resources, like we have a mitigation toolkit that is currently available that has a number of resources and tools for schools and school administrators to prepare reopening for either hybrid learning or an in-person instruction by, there's a number of checklists, there's a number of just assessments that help schools and districts to prepare for that in-person instruction and go through those prevention strategies to look at, are we implementing universal masking? How are we monitoring that? Do we have 6 feet of social distancing in classrooms? What are we doing for meal times? Things like that. So our guidance backs up a lot of what Erin mentioned. And again, we're constantly updating and trying to think of resources and tools that will help schools and parents and families plan for in-person instruction as best as possible.
Thank you. And then also there's a question for you, Dara, to share any best practice in communicating specifically with our McKinney-Vento families on schools being safe, especially looking at the long view that we may still be dealing with the virus this coming fall. And the kind of the context behind it, this individual is a McKinney-Vento liaison, and it looks like the additional context is that they're having informative community meetings to make sure that those misconceptions on the virus are debunked.
So I think some of the evidence that Erin mentioned is also really important to consider. It might not be something that is, the main communication strategy with families, but the science brief that Erin mentioned on transmission in schools and the information that is available in that brief can be really helpful for schools to translate for families and to reiterate that schools have not been shown to be the main driver in transmission. And so, and within schools, as long as when those mitigation strategies are put in place and followed consistently, schools can be safe to reopen in person. Think that, our guidance also does include a lot of tools like posters and communication documents that can be used within school buildings. But yeah, I think it's a really tough one. I think when it comes to communication with families, another thing that's stressed in our operational strategy is the engagement of the school community in reopening. So if there is a district that is planning to reopen in the future or even planning, for reopening in the fall, it really stresses the importance of engaging many members of the school community in that reopening process. So that would include school administrators, teachers, student and parent representatives, and also specialized school staff like transportation officials and food service workers and things like that, to ensure that you have the perspective of lots of different people within the school community, and to also have a stronger plan for reopening so that those perspectives are considered all the way, throughout the process. So, the operational strategy specifies as that being pretty much required for a successful reopening, because it's important that, many voices are heard, and in particular, underserved families within the school community to consider equity issues.
Thank you, Dara. And then
I was just going to jump in a little bit there, if that's okay. Sure. So, McKinney-Vento students are sitting in the space sort of between our units, between our schools unit and between our homelessness unit. So I did want to point out that one thing that liaisons can possibly be thinking about is linking into the homelessness work that's probably happening on the community level, where what we recommend in our guidance is there be a coalition of public health, homeless service providers, and other community organizations that work with people experiencing homelessness to make a plan to protect people experiencing homelessness. So if you're not currently connected with that communication that's happening, think about ways to find out who's doing that and who's coordinating it. And that might be a good way to get some information that those McKinney-Vento families might find useful if they're accessing homeless services, if they're staying in shelters. That might be a good conduit to help them.
That's an excellent point. And to that, Emily, do you have any specific communities that you're aware of that have established these coalitions that help with that communication process?
And actually, it's fairly widespread. So ideally, everywhere would have this on both the state level and on the local level, with the understanding that on the local level, it's more important because that local level coordination is really crucial to getting information out to people and planning for response. So we on the federal level have kind of an analogous system where we're very connected with HUD, the Department of Housing and Urban Development. So they are they produce materials that that go to homeless service providers that they can use to communicate related to COVID-19 prevention and response. We work on the CDC side doing similar things. So on the local level, there's a lot of that happening as well. So I would say it could be helpful to look on our website, but also check out HUD's website because they have a lot of materials that are pretty accessible and useful communication tools.
Thank you. And with that, Emily, I do want to go ahead and pivot now and talk a bit about vaccines and vaccine rollout. And I know that I'm sure there are some questions for attendees who don't yet have their vaccination and who may not be in a state where educators, teachers are prioritized in that first class. If you could go ahead and talk a bit about the CDC efforts in regards to that.
Sure. So I will talk a little bit about the homelessness side, since that's the unit that I lead. On the teacher side, as Erin mentioned, teachers and educators are considered to be part of Phase 1B through the Advisory Committee on Immunization Practices from CDC. But of course, as we all know very well, it is a state-by-state decision. And I'd be curious if anyone has already been prioritized, has already gotten vaccinated. If you want to add it to the chat, it would be interesting to see where things are happening and what's going on the ground. So related to homelessness, it's similarly variable across the country. We have some states who have specifically prioritized people in congregate settings. Some states have specifically prioritized people experiencing homelessness, and some have specifically prioritized people in people working in homeless shelters. So there's these different categories that kind of cover different populations in different ways. And then there's some states who have gone a fully age-based prioritization. So then people, who are staying in homeless shelters or who are staying outside are prioritized by their age or by other conditions. So it's really variable in terms of what's happening and in terms of where and how rollout is happening right now. But we do have guidance now on our website related to vaccination for people experiencing homelessness, because there's a couple things. So this is going to relate to the families mostly of students that you might be working with, since the vaccines right now that are approved are 16 and up for the Pfizer vaccine and 18 and up for the Moderna vaccine. So a couple things in terms of reaching those families. We think about both making sure those families can access vaccine when it's available to them, and also making sure that they're confident in the vaccine. So in terms of access, we want to ideally, we know from other vaccine programs that reaching people experiencing homelessness with vaccination, bringing the vaccine to them is the most effective way to get vaccination out there. So that's something that we really highlight in our guidance. And then when we're thinking about vaccine confidence, there's a wide range of people's perspectives of this vaccine among people experiencing homelessness. We don't have formal data right now, but we've done listening sessions where we've gotten to hear what people feel about this vaccine and whether or not they feel confident in it. And it's very similar, of course, to the general population. Some people feel like it's moved too fast. Some people feel like they don't know the data well enough yet. Some people have a history of trauma with the medical system and they don't trust that this vaccine will be beneficial to them. So there's a lot of different ways that we need to move forward to make sure we're addressing that confidence, providing data, making sure that we get information out that shows how many people were in these trials and how long they were followed up for safety and efficacy is going to be incredibly important, because ultimately there weren't any shortcuts taken on the vaccine safety side of things. The production was sped up. That's how we were able to do this so quickly. But the safety side, it was held to these vaccines are held to the same standards as every other vaccine. So getting that information out there will alleviate so many concerns on the confidence side. And then meeting people where they are is another important thing to be doing, because people have reasons to have mistrust, and we need to be open to talking to people about what their experiences have been, what they need from us to be able to feel confident in this vaccine, and giving people time to think about it. You know, making sure that we have options that let people, you know, that bring the vaccine. Maybe there's a vaccine clinic at a shelter or at another site that provides services for people experiencing homelessness, but letting them, maybe they don't want to get it that time, letting them come back and get it another time is also going to be incredibly important. So those are just a couple things in terms of vaccine rollout. Obviously, we've been thinking about it a lot. So that was sort of a lot of information. I'd be happy to answer any questions on the homelessness side. And actually, Dara, I don't know if you have anything on the school side to add.
We don't. A lot of our guidance doesn't fully address vaccination just yet, aside from the operational strategy, which specifies CDC's, encouragement that teachers be, put at a high priority for receiving the vaccination.
Thank you both. And then in regards to pending approvals for new vaccines, any additional information in that front? I think February 26th, if I'm not mistaken, is the Johnson & Johnson approval process. And then there's also talk of boosters too, with Moderna and Pfizer. So if you could talk a bit about that.
Yeah, so in terms of the Johnson & Johnson vaccine, you're exactly right. There will be 2 meetings to review the data, one from the FDA, that's on February 26th. There will be a meeting from the CDC's Advisory Committee on Immunization Practices that will happen after the FDA meeting. Both of them are open to the public, so anyone can join these. They're going to be reviewing the data from the trials from Johnson & Johnson, the single-dose vaccine. What Johnson & Johnson has published already shows that in the United States, the efficacy of the vaccine was 72%, so a little lower than the other vaccines. So when we're able to look at the data and start thinking about this, we'll have to start to balance, the pros and cons of a single-dose vaccine that might be lower efficacy compared to a 2-dose vaccine that has very high efficacy. So that's something that will be coming. We can't really make a decision about it quite yet. I do want to point out there's an ACIP meeting that's on the 24th, 25th of February that is not going to be talking about the COVID vaccines. So you don't have to sign up to watch that one if you're looking for answers on COVID. They'll be scheduling it after the 26th.
And any talk about the boosters, whether we're
Yeah, thanks for that question. I don't have any information about the boosters right now, but I can send you information if any comes available that I have access to.
Perfect. And then we had a response to the question on vaccinations, not an option in Florida. Bladen County, this individual is going to get a shot next Thursday. Congratulations. Michigan has prioritized teachers. In fact, one of our board members just received their first shot. Educator in Virginia will have their second shot next week. Arkansas just started vaccinating teachers. North Carolina is. Cody, Wyoming has vaccinated. Some have already gotten their second shot. Wow, Hampton, Virginia, 70% of school staff has been vaccinated. Wow, congratulations. Southern California, they opened up vaccination for Tier 1, 1B, which includes education and child care workers. Who are the decision makers in this process? Do you have any guidance on that, Dara and Emily, if people want to try to find some guidance on how they should go about making sure that their educators are prioritized?
Yeah, well, for one thing, I am happy and surprised to hear that there's a fair amount of vaccine rollout going on. So I'm excited about that. The decision makers in this are at the state level. So connecting with the state health department to make sure that you know when your turn is coming up is going to be really important. So, and it is pretty different by state, as you can see. There's all different types of prioritizations out there, and the same goes for homeless services. It's variable. We've heard of some sites that have vaccinated hundreds of people, and some that haven't even gotten started.
Okay, and we have some more questions regarding vaccinations. Are there any handouts that outline the vaccine information that can be shared with McKinney-Vento families and students?
Our website doesn't have anything that's specific to families that are experiencing homelessness right now. The HUD website, I think, does, or might very soon. So let me look up their website and I will put it into the chat, because that will be a place to look, because they do have a lot of resources that are very helpful.
Perfect. And another question is, since about 70% of McKinney-Vento students are in doubled up settings, not in a shelter, there's concern under identification and difficulty accessing vaccines because they are not associated with a shelter. Do you have any advice for how liaisons might be able to ensure these students are seen and served?
That's a really good point. So we use, on our side, we use the HUD definition. So we tend to focus on congregate shelter settings and on encampments, but it's really about access to services. So if you can connect your families to homeless services, there are or if they're already connected, there are going to be linkages to vaccination through those. So for example, healthcare for the homeless is doing a lot of this vaccination, and they'll be able to make linkages with families that are, even if they're doubled up, it doesn't really matter what their situation is. So that would be so helpful for liaisons to help make those connections to get vaccine.
Great, thank you. That's great advice. Another question is, do you think the COVID vaccines will over time become a required vaccine for school attendance?
That's a really good question that actually people have been asking since day one, I think, is just requirements in general, not just for schools. I don't, from the homelessness side, and I'll let Dara jump in. I have not heard anything from the homelessness side about requirements for vaccination among employees or anything along those lines. But Dara, I don't know if you have any insights on this.
Unfortunately, I don't. I also haven't heard anything internally. I mean, I've heard a lot of talk about it just in the public in my daily life, but as far as any plans to address that or plan around it becoming required, any talk of it.
Okay, we have another question. Is there any guidance on COVID testing staff and students at school sites once we are allowed to return to in-person instruction?
So I'll jump in for that one. The operational strategy, which I added the link to the chat box, but it's probably a bit hidden now, but with all the answers to the good questions. But it does include a good amount of guidance on testing in schools. We talk about it as one of several possible prevention strategies, recognizing that it's not feasible for all schools to offer testing directly in the school setting, but our guidance does specify that diagnostic testing, which would be symptomatic students, teachers, and staff, or close contacts to symptomatic individuals, diagnostic testing should be referred across the board, no matter the level of community transmission for the school district or for the area that the school district resides in. Diagnostic testing should be referred across the board. And then we talk about screening testing, and that would be routine testing of all, teachers, students, and staff, whether that are asymptomatic or pre-symptomatic. We recognize that that's, again, not feasible for a lot of settings, but when it is possible, it should be prioritized for teachers and staff. And there's kind of a continuum along which it can be considered for various grade levels and for teachers and staff based on the level of community transmission in the area. So that guidance is there. There's a little bit more detail in the plan about approaching that testing strategy and what to consider, what needs to be in place before even considering a testing strategy. But I think one take home is that diagnostic testing and referrals for diagnostic testing can be made across the board, regardless of the school's ability to offer testing directly.
Thank you, Dara. And we have another question in, and this person says, I've heard the Johnson & Johnson vaccine is more effective against the variants. Is this true? And can a person choose to get the Johnson & Johnson vaccination?
Thanks for that question. So again, we have not seen the data yet. The only thing available right now is a press release from Johnson & Johnson. And it appears from that they were able to test with some of the variants, or at least the trials were able to include some areas where transmission of variants was occurring. So I think we're going to learn more very soon, obviously, as the FDA meeting is next week. The choice of vaccine is, it's probably still going to be a little while before there's going to be an ability to choose between vaccines, because that's going to come down to manufacturing and how much is available. So once Johnson & Johnson gets ramped up and starts getting sent out, there may come a time where it's possible to choose between the two, but it might be a little bit before that happens.
Yeah, I keep hearing people say that the best vaccine is the available vaccine.
I completely agree with that.
Okay, so I'm going to read a few more comments here on what states are doing, and then if I could get some final thoughts from both of you. And I think, one of the things I want to make sure that the attendees get is just encouragement, right? Encouragement that help is on the way, encouragement that they are going to be getting the vaccines. Sorry, we have a visitor at the front door. If we could go ahead and go with your final thoughts, Emily, if you want to start.
Sure. Well, for one thing, I do want to point out that I don't know if you all have looked recently at the daily case totals, but we have been on a steep downward trend since the holidays, and vaccine, as you can see from the chat, is rolling out. There will be more that we have to do to end this pandemic, but we are heading in a good direction right now. And I know everyone is so tired, and I cannot imagine how much work you all have put in over the past year to make things work. But I appreciate you. I appreciate your questions. We are available if you have more questions, or if you have issues that come up, please reach out. And thanks again so much for your work.
Dara?
Yeah, I would just echo everything that Emily said. I think that there are reasons to be optimistic and hopeful for what's to come in the next few months. I'll just reiterate that, you know, a lot of the guidance that the school that is coming out related to K through 12 schools focuses again on those prevention measures and recognizing that it is possible for schools to reopen safely when those measures are in place. And a lot of times it's a matter of, you know, getting everybody at the table, getting the right people at the table to plan around putting those measures in place. We can reduce the risk for students, teachers, and staff in the school building. We know how important it is for schools to be open, so recognizing that that's the direction that we're going in, that many school districts are planning around, you know, there is guidance out there to help reduce. And I also want to say to stay tuned, because as I've mentioned before, you know, I think everybody in our unit is just always constantly focusing on, you know, what is the new evidence coming out, is the new information that is available to us to be able to update our guidance, make it as up-to-date and relevant as possible, and what tools can we develop that can help school districts and families make decisions around school attendance. And, you know, I recognize that in the next few months, you know, there are going to be a lot of updates, a lot of new information that we can then translate into guidance and tools for the public. So please do stay tuned for ongoing constant updates to our guidance, and the links that I included, or actually all the links that have been included in the chat box, I think speak to a lot of the school guidance. So thank you.
Wonderful. And then there was a question that I do want to go ahead and let everybody know, and also for those who will be viewing the recording, they won't be able to see the chat. And the question was whether or not the vaccination was free. And Emily, you want to go ahead and say a few things?
Sure. So vaccination is provided free because the US government already paid for doses ahead of time. So there can be administrative costs associated with providing the vaccine, but vaccine providers can get those reimbursed through a fund, and they're required based on their agreement to provide vaccination to anyone that regardless of their insurance status or their ability to pay.
Thank you. And then there was a question regarding all the links that were provided. I did take screenshots of all the links that were provided in the chat, and I will provide it in a follow-up email on MailChimp. Because I didn't require registration for this particular event, I don't have your emails of those who have attended today, but I will go ahead and send that out in a mass email. Someone, and I don't know how much time we have here, a little bit of time, but someone wanted to know what the vaccine was made out of. And I think maybe it's just a matter of, I know people were concerned with whether or not they were getting the live virus in their bodies, and my understanding is that they're not. But Emily.
Sure. So there are inserts that are available online that have the ingredients for the Moderna vaccine and for the Pfizer vaccine. And then there will be one available for the Johnson & Johnson vaccine as well. So the mRNA vaccines that are out right now and the Johnson & Johnson vaccine, they don't include COVID virus. The mRNA vaccine includes a portion of, it's called messenger ribonucleic acid, and it codes a protein that sits normally on the outside of the virus. And so if you were to get the virus, that little protein stimulates our immune response to attack it. So we just have the little code for that protein, and then the vaccine has your cells make it, and that mRNA is removed from the body, it's broken down. Your cells make the little protein, your immune response responds just to that little component. So the risk, there's no virus. And also another question that comes up a lot is whether or not it can integrate into your DNA, but DNA is a different molecule than RNA, so they're not the same, so it can't integrate.
Thank you, that was very informative, thank you. And then is there a link for the informational pamphlets?
Yeah, if you're going to send around an email with links, why don't I know I said I would put a lot of things into the chat and then I didn't, so why don't I kind of compile all those and you can send them around.
Perfect. Well, with that, we thank you both very, very much. We know your time is so incredibly valuable right now and always, but certainly right now. And we thank you for taking the time to share your expertise and your information with all of us. So thank you all. And thank you all to the participants. I will be following up with the mass information by email for all of you. And it will be provided by recording as well. Have a wonderful day, and thank you for all that you do. Be safe, be well. Bye-bye.
Thank you so much.
Thank you.
Thank you.